Hello, I hope you're doing well. Thank you for joining me again for this series of videos on COVID-19. My name is Rob Marshall. I'm the CEO at Bolivar Medical Center in Cleveland, Mississippi. In the last segment, we covered the spread of the virus and the ways you can help prevent infection. In this segment, I'd like to discuss emergent symptoms of COVID-19, the different types of testing available, safe quarantine measures, and when it's okay to go back to work. COVID-19 symptoms can range from moderate to severe and may appear as early as 2 days or up to 14 days after exposure. If you're an older adult or have a severe underlying medical condition like heart or lung disease or diabetes, you could be at a higher risk for complications from COVID-19. The CDC lists a number of symptoms on their website, but emergency warning signs for COVID-19 include trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, and bluish lips or face. If someone is showing any of these signs, call 911 or call ahead to your local emergency facility to let them know that you are seeking care for someone who may have COVID-19. If you feel you may have been exposed or are unsure about your symptoms, you can visit bolivarmedical.com to complete a free online COVID-19 risk assessment. Simply click the COVID information banner on the homepage and follow the instructions listed. If you think you need to be tested, there are a few options for you. A diagnostic test will show if you have an active coronavirus infection. There are two types of diagnostic tests, molecular and antigen. The antigen test, also known as the rapid test, is a screening that provides results in 1 hour or less. The molecular test, or send-off test, may take up to 48 hours to result, but it is the most accurate type of testing for active COVID infection. These tests are offered at the hospital and at the Cleveland After Hours Clinic. Another type of test that is not diagnostic is an antibody test. It detects antibodies in your immune system that may show you've been infected by coronavirus in the past. If your diagnostic test is positive, stay at home, except to get medical care. Separate yourself from other people and monitor your symptoms. Take extra measures in the home to clean and disinfect. If you have a medical appointment that cannot be postponed, call your doctor's office and tell them you have or may have COVID-19. This will help the office protect themselves and other patients. You may wonder when it is safe for you to be around others if you've had COVID-19. If it has been 10 days since your symptoms first appeared and 24 hours with no fever and other symptoms are improving, it should be fine. This is the process we use at the hospital for employees that have tested positive. 10 days, no fever for 24 hours, and improved symptoms. A negative test is not required for employees to come back to work. Even as life returns to a new normal, you should know that we aren't letting our guard down at Bolivar Medical Center. We have learned so much through our response to this pandemic, and we will continue looking for new ways to improve. Because of this experience, our team is stronger, our hospital is safer, and we are even more deeply committed to caring for our community. If there are topics or questions that you would like to see discussed, please email those to the address listed in the video description. Thank you for listening, and thank you as always for entrusting Bolivar Medical Center with your care. It is our privilege to serve you.